But let's get started. I mean, today, as you can see, we're going to be talking about leadership versus management and building a high-functioning veterinary team. So today we have Sam Millett leading the conversation, who brings nearly 20 years of experience in the field. She started at 16, that's right, 16, and became passionate mentor and practice management expert. So she knows what it takes to build strong, cohesive teams. What you can expect is a conversation around real world strategies, case studies, and tools that you can use right away.
And
Uh,
this is my owner
going to
tray
be
got
tackling the
mixed.
key
Like it's
differences
not from
between
my
leading and managing as well. Uh,
all of that is automatic. So
and
where do you I'm not able to see your
there'll be
pay
some
stubs.
awkward moments too, and that's fine. But with that being said, I want to pass it over to Sam. Welcome.
Thank you so much for the introduction, Daniel. I super appreciate it. And thank you all for joining today and carving an hour out of your day to spend with me. I will say I'm no expert by any means. I'm just going to talk about kind of my experience and how I have grown in the industry because I was very green when I first started and along the way have learned from many colleagues on how to do things in a proper way, in a much better way. So just here to share some experiences of what I have went through and things that I've learned. So hopefully you can take a little bit of a nugget of information back to your hospital team or for you in general just to help at your practice. So thank you for being here today. I really appreciate it. Agenda for today is just introducing myself. Daniel just gave you a brief overview of that. We're going to dig into what is leadership versus management and how do we make those exist together? What's the difference between those? And what does that look like in your practice? The impact that leadership and management has on your team, some practice tools and strategies, and then we're just going to have some open discussion just to see what works with your practice. If you're running into anything that you think we need to discuss, any information that I can provide to help, I'm happy to do so as well. So, who am I? Again, Sam Millett, CVPM. I've been in the industry for 19 years. As Daniel said, I started at 16 as a kennel assistant in a very small town in West Tennessee. It was a mixed rural practice where I worked, and we had two DVMs at the time. A cool piece of information that I always like to share about myself because it's very rare. In West Tennessee, we have a safari zoo, which is very unheard of. And I helped deliver via C-section a baby camel with one of the DVMs that I was working at the time. The owner of the safari zoo was this older gentleman that had kind of dabbed in different things throughout the years, and his wife, they were both a little bit older, probably 70s, had made greens the night before, and they had a very, very pregnant camel that was due to give birth at any point in time. She had leftovers. She didn't want to throw them away, so she gave them to the camel. The mama camel got very, very sick and was not going to make it. So called the doctor that I was working with at the time, and he said, I've never done it before, but it can't be any different than a cow, so let's give it a go. And off we went, and we went to the safari park and delivered the cutest little baby camel that you've ever seen. Unfortunately, the mom did not make it. She died a couple hours later, but it was just a really cool thing that I got to do that I will never forget and just is not very common for somebody in Tennessee. So there's that little nugget of information for you. As far as myself and where I started, again, in a mixed practice as a kennel assistant, kind of worked my way up to helping in surgery, doing all that jazz. After high school, I went to Knoxville, where I resided for a very long time and did my undergraduate, got my bachelor's in animal science, was on the track that I thought I wanted to be a veterinarian. That did not pan out. I knew I still wanted to be in the industry, but wasn't really sure what that looked like. I had been a technician. I was not licensed, but could pretty much do anything, but knew that I wanted to contribute to the industry somehow and wasn't really sure what that looked like. I got offered a practice management position at a hospital that I was working at Knoxville. Wasn't really sure what I was supposed to do or what that looked like, but I knew I wanted to further my career and do more. So I started looking into the certified veterinary practice manager and started that venture. It was really, really awesome, and I have met so many colleagues around the world basically that I continue to talk to every day, weekly, monthly, and it just means the world to have people in the industry that you know that you can vent to, that you can talk to, that you can bounce ideas off of. It just helps so much in this industry. With my CVPM, I got involved with VHMA. I do not represent anybody. I'm not here to say, do this or do that, but I will give a shout out to the Veterinary Hospital Management Association. If you are not a member with them, you should definitely become a member with them. They have a lot of like open forums for practice managers, for hospital administrators, owners, managing DVMs, and there's CE that they do, there's webinars that they do, annual conferences, and it's just a good connection to meet with other practice managers in general practice, specialty, emergency, large animal, and just to have that relationship to build with. So, I personally have a passion for practice managers that have never been in the position and are kind of bled out there for the sink or swim situation. I have seen too many people get burnt out in this industry, get frustrated because they don't know what's going on, just aren't comfortable because they don't really understand it. So I have a huge passion to just help other colleagues to get whether they want to be a CVPM or if they just want to excel in being a practice manager and how to show up for their team. So that's what we're going to talk about today. Again, no expert, just from personal experiences and the things that I've learned along the way. In my free time, I do have two small children, two little girls that I love to death, and two geriatric dogs. So my husband and I just spend all of our time doing that in our free time. And we're just in a season where we're very, very busy, but we're very, very blessed for that. Okay, so if you have your phone close to you, or you can type in this link, this is tell me for people that are in this call, what best describes you currently? Do you consider yourself a leader? Do you consider yourself a manager, or do you consider yourself both? And this is a no judgment. This is judgment free zone, whatever you are. And I'll speak to what I was probably 10 years ago and then to what I have become. So I'll give everybody a few minutes. And let me know if you guys are having any issues with it. Is it working for you guys, or are you having issues?
I think it's working.
So Sam, it tells me I don't have permission to view or respond to this form.
Oh, sad. Okay, it's not gonna work. Okay, well, everybody that can participate, just shout it out if you think that you are a leader, a manager, both. How are we feeling? What do we feel like?
Seeing some boths in the chat.
Okay, love that.
Wow. A lot of boths.
Okay, love that.
Nice. It's almost unanimous. Annie said, I am what you are.
Yes, you are. Okay, perfect. So sorry that did not work. I hate that didn't work. It's kind of a cool little poll to do, but that's okay. I was 10 years ago a manager. I had no idea what I was doing. I thought that when I went into work and as a leader, I was to just be a manager and everybody just needed to come to work and do their job. And it is what it is. Like there was no empathy, there was no compassion. I had no idea what leading a team meant. All I knew is I need to go in and be a manager and be stern. And that was absolutely incorrect in so many ways. So over the years, I have grown to understand and learn how to become both a leader and a manager. And it was by no means the easy path, as I took a lot of falls. I had a lot of, great times too, but there was a lot of learning in between. So, what is leadership versus management. Let's dig into it. What does leadership look like to you currently? What does management look like to you currently? Are you confident that you can distinguish the difference between the two? Do you currently know how to lead your team with both leadership and management? Do you find it hard to manage both leadership and management together? Hopefully, in our presentation today, we'll define the key differences and figure out the best way to support you in both of these roles. Then we're going to explore how each of these may affect your team's culture and performance. We'll look at real life practice scenarios. And finally, I'll leave you guys with some actionable strategies to lead and manage more effectively. The next two slides I took just to do an overview and to give you guys some insight on satisfaction in the industry and then staying in the industry. So Merck does a study every couple of years that just basically does a poll for team job satisfaction, and you can see veterinarians are on here, your hospital administrators and practice managers, your LVTs, your assistants, your CSRs. I would love to see our industry be like 75% for this, but as you can see, the highest is at 56 with our DBMs and then goes down to 44% at our CSRs. So why is that? What can we do to make the industry better and our teams more cohesive so that the satisfaction is greater? Another one that I found very interesting is just where do you see yourself in the next 3 to 5 years? So you'll see that the red is I'll likely leave the profession, which is pretty big for our CSRs, minimal for the others that are up there. The orange is I will likely leave my current practice, but stay in the profession. So DVMs and technicians are highest in that, whether they're moving somewhere or taken somewhere with larger pay or whatever that may look like. The yellow is I plan to remain at my current practice, but in a different role. The light blue, which is awesome and I love to see, is I plan to remain employed at my current practice and role. And then the very bottom, the dark blue, is unsure. So you can see the majority of the people in this profession plan to remain employed at their current practice and be in a position, whether that's being in the current position or if there's a promotion that's available, which means there's got to be some satisfactions some way or somehow. So where do we start to make the change? It starts at the top, right? It doesn't matter if you're privately owned or you're corporate owned, we're all struggling with the same issues. And that is leadership and management. So how do we bond the two together to make sure the team is getting the buy-in that they need and that your team is happy and supportive? It starts with you, right? You as the hospital leadership are the ones the teams look up to and they want that guidance from. If you can't give it your all and be happy, why should your team? The team wants to be recognized. The team wants delegation. They want fair pay. They want a good work-life balance. So if you're there to support your team, they'll be there to support you when you're in need. So let's talk about the difference. What is the difference between leadership and management? Leadership is the vision, influence, and inspiring others to follow a common purpose, a smooth running hospital with a high functioning team that will mostly operate well together. You see it, your hospital leadership sees it, your team sees it, your clients see it. This is how you can help with turnover, burnout, and making sure your hospital has a wonderful reputation for providing gold standard medicine, all while providing the best patient care around. If there's a break in your team, everyone sees it. Your team feels the tension and animosity. The clients see it on your employees' faces. The atmosphere is dull and not inviting. So, how do we as practice managers navigate being a leader and a manager at the same time? Management, on the other hand, is structure, process, day-to-day operations running smoothly, and it is very much system focused. But in our setting and being a practice manager, we need both. We need a strong leader and we need a strong manager. So a strong leader without management skills often inspires your team, but creates complete chaos, which we definitely don't need. There's enough of that going on. On the other hand, a great manager lacking leadership may keep the team and hospital in order, but at the cost of your team morale or innovation. Think of it this way: leadership builds trust, encourages growth, and helps team members feel connected for a greater purpose. Management enforces standards, maintains consistency, and supports productivity. Without leadership, a team may lack direction, and without management, it may lack stability. Success lies in blending the two together. Again, I'll talk a little bit more on this. When I first started as a practice manager, I was definitely the manager that just thought you needed to do what you needed to do, and there was no ifs, ands, and buts about it. It was very much process straightforward. It took me a few years to figure out that I also had to incorporate leadership with my management, and I had to have more of a heart and empathy and consistency and being there for my team. It took feedback from other colleagues, from employees, and for me just to understand like how I could be there for the team as both a manager as well as show leadership. So it was a very eye-opening event for me to figure out that I couldn't just be a manager and that I had to blend both leadership and management together. So let's just envision a day in your hospital. We're just going to pick a scenario. Um, and how we would address it appropriately with both strong leadership and management. So we have a packed schedule with surgeries and appointments back to back all day. It's 9:30 in the morning. Two of your techs are arguing. Your appointments are at least an hour behind. Your surgery patients have arrived an hour early, but no one has assessed them and no one is ready to start the day. Now it's about 2 o'clock in the afternoon. Your surgery schedule is still running behind. Your appointments are also still behind. Your inventory is low. No one's ordered, and there is just complete chaos. So, how do we address all this? How do we address that conflict within the team? How do we make sure our clients and patients are happy and they're getting the care that they need? The leadership moment for this situation would be to step in, to coach your team, to mediate the issues that are going on, and build your team's trust. I absolutely recognize that this is not an easy task as everyone is going crazy. Nothing is going correctly for the day, and no one's interested. But you, as a practice manager and as a leader, can help coach and give guidance on how we can overcome the appointments being an hour behind, your surgery patients not being ready for surgery. A way that you could step in as a practice manager, you could step in and be in the back with your team to help coach them. Is it that you need to hold a dog for one of your LVTs or the assistants? Does your DVM need you to go run and grab a bag of food? Like, what is it as a practice manager that you can do to help with all the chaos that is going on? When you step in the moment and you're coaching, you're earning the team's trust and they can see that you're there to help them and you're not just a manager in your office doing office duties. You're letting your team know that you're there in the thick of things to help them, to help take some of that stress off of them, and you're showing them that you're there as a leader to help them. So, what does that look for the management aspect of this? So, let's take a step back and figure out, are we running behind because the schedule needs adjusting? Did we not schedule enough people for the day? Did we have people call out and we had to rearrange some people and we're short staffed? Do procedures need to be updated so the staff have something to follow for guidance? Is there a process in place for ordering inventory? Do you have an inventory manager? Do you have someone you can delegate to make a list, order from Vetco, or is that all on you? What does that look like for your hospital, and what steps can you take to delegate and help make these things be smoother? In this moment, whether it's your team butting heads and patients are behind, or still being behind in the afternoon and low on your inventory supplies, For you as a practice manager to step in and take the reins to benefit your team and help with a culture is what great leadership and management are combined. And from experience, I can tell you that I have seen it. I have been in the thick of it when this has definitely happened at a practice that I was at. And it literally means the world for the practice manager or maybe a DVM that's in the office just to come back and say, you know what can I help with? And I guarantee you, you're going to get buy-in from your team that they're going to need your support, need you to help, and it will tremendously help them being in the rut and being behind. So another one that we're going to focus on is burnout in the field. And this is just across the industry. It's not for anyone specific. Some veterinary clinics experience high staff turnover due to burnout or due to emotional exhaustion. This leads to a lack of team cohesion and no one wants to work together. So how do we as a practice manager step in as a manager and a leader to help retain your staff? We as practice managers need to focus on staff well-being. If there's one thing that I've learned over the years, and I have learned it more in the last probably 6 years of my life in doing this, is work-life balance. I honestly didn't realize how important that was until I had a family of my own and needed to put my family first. A lot of people in this industry either have a family and need to put their family first or maybe don't, but they don't have a good work life balance, and that can lead to burnout in the field, which we don't need to do. Our mental and health well being is way more important than our work. That was one thing that I preached on as a practice manager, is that your work life balance is more important than anything in the world, and your family comes first no matter what. Work will always be there. Your family will not always be there, so spend the time that you need with them. I can't tell you how much as a practice manager that I learned just interacting with my employees, going back to their departments, just checking in on them, saying, "Hey, Sarah, how are you doing?" Or, "Hey, Derek, how did your weekend go? What did you do for fun?" If you have a staff that trusts you, they're going to share what's going on. Are they in a good place? Are they in a bad place? Granted, with that being said, we all know everyone has something on in their personal life. And we strive to do the, leave everything at the door and just come to work. But honestly, as an employee, and you've probably dealt with this too, that if there's something going on in your personal life, it's probably going to affect your performance. So maybe your employees have something personal going on and they're not very talkative, or maybe something else more in depth is going on. We're definitely not here to be their counselor, so please hear me on that. But as a leader and a manager, you do need to have empathy and be there for your employees. You, as a practice manager, know your employees. Um, Unfortunately, there are employees that, just try to get out of things just because they can. But then on the other side of that, you do have the genuine employees that are there to work for you and want to be there. But if they have something going on personal in their life, maybe they just need a day off or a mental break or just support, saying, you know what, I've got a lot going on. Give me grace during this period. Um, so burnout in the field for the leadership, a leader builds a positive culture. They show genuine appreciation and they foster open communication. They inspire your team by reinforcing the why behind the work, and they help each team member feel valued. Your management hat for this is you're doing stay interviews. You're having those one-on-one with your employees and saying, why are you happy? What makes you happy? You implement clear onboarding. If you have new employees starting and you don't have a clear onboarding and training set up, it's probably going to lead to a disaster further on and lead to burnout. You ensure that your employees have a good work-life balance, and that's across the board, starting with you all the way down to kennel assistants, your CSRs, everyone that works in your hospital. Another challenge that seems to be pretty consistent across all hospitals is lack of accountability and consistency. Scenario: you notice some of your team members are not following protocols that have been implemented. This is leading to inconsistent patient care or bad client experience. We've all had this happen, whether it's your CSR, your tech, your DVMs, it's across the board and can happen to any of your team. So, no one wants to hold anyone accountable for their actions. They don't want to have that confrontation. People are uncomfortable with confrontation. But on the backside of that, there's chit chat going around because somebody's not doing their job right or no one's doing their task correctly. It's not a healthy environment for your team. So, how do we as practice managers address this? So, as the leader, we must set the tone and expectations for this behavior. It starts at the top with hospital leadership, and that includes all of your DVMs, administrators, your managing DVMs. If things need to be addressed, it needs to be done with a conversation with that said person or group of people, depending on what you guys have going on. And we need to listen and figure out the why behind it. Are there not clear expectations? Are there clear expectation and the team member just doesn't want to follow it? What does that process look like? Maybe it's on you to retrain the staff on a certain task. Maybe there's something else underlying that needs to be addressed. It's on us as practice managers to dig into the situation and evaluate the best step forward. Could it be a simple fix? Could it be just a conversation with your employee or group of people? Is it a performance improvement plan that needs to be addressed? So, our leadership for our lack of accountability and consistency is to set the tone and expectations for the behavior and integrity of the team. You model the standard, address issues with empathy, find out the why, and build trust so others feel safe coming to you with giving and receiving feedback. You want to have a safe environment for your team to feel comfortable to come up to you and say, hey, you know what, Sam, this employee hasn't really been doing their job, and here are their examples. And then on the other side of that, saying, you know what, Sam, you really haven't been present the last couple of weeks. You haven't came back to the back to check on us. You just haven't been there at all. Is there something that you can do to get back into that routine? So maybe it is that interaction with the employee to say that maybe we're not doing the best that we can do. So how can we hold ourselves accountable to our team? And on the management side of that team, are your standards of procedures written? Are you trained on them? Are they enforced? Are you tracking errors and holding your employees accountable with data and coaching? You cannot just go up to an employee or a DVM and say, you know what, you're just doing terrible at this, and have no examples, have no documentation, and have no way to solve the problem. That's not going to fix anything. As a practice manager, it's on us to be able to track what's going on, provide documentation, and then coach on what is going on. So, do you have PIPs or PIPs to hold your staff accountable? Do you have those performance improvement plans that you actually sit down with your employee or department, depending on what that looks like, and actually follow through with them? Those are meant over a course of time, whether it be 2 weeks, a month, or 6 months, for you to have those check ins every week, every 2 weeks with that employee to say, hey, this is what we had your PIP for. How can we continue to fix this? Or are you running into any issues? So we have to hold ourselves accountable as well as our staff. Okay, this is a big one. And I feel like over the last 5 years, especially since COVID, our client complaints and blasting people on social media or declining services. So, scenario for this is you have a client arrive 10 minutes late. The team is on the train of, we're definitely not going to make room for this person. We're back to back. You're going to have to reschedule. The client is not happy with this. The client was actually late due to a family emergency, but the CSR never took the time to ask and just said, you know what, you were 10 minutes late. Forget it. Find another time. The CSR tells this client that they must reschedule, and the client loses it in the hospital. They go off on the CSR, say what a terrible hospital it is, and then they go home and do a Google review or a Yelp review that's negative. So, how as a team, how could this have been handled differently as a leader and a manager? So, client complaints seem to be an issue at this day and time just because social media is so prevalent and we have so many platforms for that. So, how do we as professionals address this, and how do we get our team on board? Whether we want to hear it or not, we are a customer service based industry. Attached to every patient that we see is a client who has to pay for those services and actually choose to come to our hospital. So, what does that look for you as a practice manager with leadership and management? First off, it's okay to admit you're wrong or you made a mistake. We're all human. Nobody likes to say that, but we're also human and we're not perfect. So there are things that are going to happen that are mistakes in your hospital, whether, it's from the top, from yourself, from your DVMs, from your CSRs. And it's okay. Mistakes happen, but you have to be clear and you have to tell the truth to the client. You can't just make up some unrealistic situation. We do need to cater to our clientele, but we also need to have our teams back. In general practice, always, that was a hard lesson for me to learn when I first came into the industry was, to listen. I wasn't very good at that. I always was very defensive if somebody was blaming us for something. But over the years, I've learned that 95% of the time, if you just listen to what the clients are saying, that's all they want is that someone's listening to their complaints. And 95% of the time, it's probably nothing that you've done. It's just that they're irritated because something else has happened in their life or happened in that day. So clients just want you to sit there and listen to them. On the other side of that, you still do have to have your teams back and you do have to have a zero tolerance policy for your clients talking or screaming ugly verbiage to your team, to you. And that's the same to your team. You have to have a zero tolerance policy for your team as well as far as communication to your clients. No one likes to be yelled at on either side, whether it's the team or the client. So, how do we have a happy medium? I will say it every day and all day. I think communication is the bane of everyone's existence, and that's in regular life, in work life, personal relationship, friend relationships. I think communication is key. And even though we all know that, we seem to not go down that avenue. So, be truthful and have communication. If you guys are running an hour behind, go tell your client who's patiently waiting in the lobby, hey, I'm super sorry that you've had to wait an hour. We had this happen. What can we do to address this situation? Are you okay to wait until Dr. So and so gets done with this? Would you like to reschedule? You have to have honest conversations and you have to apologize when things are not going as planned. Some people have a very hard time doing that, but that's just part of the industry and having that customer service based industry is being able to have that honest communication, apologize for issues, and listen. So, what is the leadership part of our client complaints and declining services? The leadership part of a practice manager is to foster the client first mindset and build emotional intelligence in the team. Coach the team on compassionate communication and help lead the team on how to improve the experience. On the management side, you have to evaluate your workflow. Do you need to adjust your appointment times? Do you need to use AI or tech tools to streamline your intakes or discharge? What needs to be done within the hospital to make sure this doesn't happen? As a practice manager, I've dealt with it few times with clients calling and being angry, clients blasting us on social media. And for me, and I'll preach it, and it may be different for anybody else, but for most of the negative online reviews, the client really just wants a phone call to say what went on and they want you to listen to what went on. If you make no acknowledgement to try and make the situation correct, whether you did something wrong or the client, it's not going to help anyone and it's going to continue to make your team not feel great. There's always going to be two sides to the story. Now, I'm not saying you're going to be able to please every dissatisfied client. But for most situations where either, they had an issue within your hospital or they go and post it on social media, it really is just reaching out to the client to see how that situation could have went differently or if there's anything that your staff could have done differently. Um, I feel like with that one too, you kind of have to coach your team for everyone to be on board and everyone must want to help. So another thing that I was big on is in general practice, when there was a client in the lobby that your CSRs would address them, say, hey, and get them checked in. But I also think it's important too, even if you're not part of that appointment, that if you're walking through the lobby and Miss Jones is sitting there with Fluffy, that you just say, hey, Fluffy, it's good to see you. Or hey, Miss Jones, thanks for bringing in your pet today. And just have that acknowledgement to know that they feel cared for and that they want to be at your hospital is super important. Another big one is resistance to change or new protocols, and this is on both sides, so client side and your team side. A scenario would be the practice introduces that they're switching to a new PIMS, and the team does not do great with change, and their resistance to change. So, what does leadership and what does management look like? Leadership would be to buy in and get the team to know the why behind the change, listen to the concerns they may have, and then encourage your champions or your super users who are on board who do want to help train and make this change great. Management on the other side of that would be create timelines so your team can see those to know what's coming down the line. Offer hands-on training, do training, be interactive with your staff to help them with the change, and then track adoption milestones. I think this is across the board for all hospitals that most teams are resistant to change. Change is just hard. Change management is difficult. So I think if you've ever been through any kind of change in your hospital, you know you're always going to have a few team members who are just super excited about the change and want to help. And then you have the others who are just like, you've got to be kidding me. This is going to be a disaster. So it's super important for any change that you all may go through, that you involve your team and your clients, right? Your clients need to know what's going on. So again, it's back to communication. Listen to the concerns of your teams. You're probably going to have concerns from your clients, but find the team members and find the clients who are excited about the change that want to promote that positive energy. Changes that you may go through could be anything from renovations, moving your facility, a new PIMS like we just talked about, going from private practice to corporate practice. This scenario can be utilized in so many ways, but help and support your team or clients to get through the change together. It's a team effort, and even though change is hard, it will always be okay at the end. Another thing that we usually see in veterinary practices, and I think it just depends on the practice and the team culture and environment, is the underutilization of team skills. So your technicians and assistants aren't working to the top of their license, which could be leading to inefficiency and frustration in your practice. So what does that look like for leadership? Advocate for your team, celebrate their abilities, encourage attending CEs and professional development. Give them that avenue to promote to be better at what they do. The management side of that is review your job descriptions, set clear expectations, reassign tasks to align with each other's roles and their full capabilities. Your staff want to do more. Granted, I know there's always the staff that are just happy for where they're at, understood, but most of them want to excel in their career. So give them the tools to do this. If they don't have your support and buy-in, they'll find it elsewhere and not be happy at your practice. Maybe that's your kennel assistants that want to do more on the technician side. They want to learn how to hold a dog. They want to learn how to set up a fecal or heartworm test. Or maybe it's college students that want to go to veterinary school that are either working as they can or in the summer, or maybe it's your CSRs that want to take on some administration work. Give your employees the avenue to be promoted and do more. Most of the times, as long as your team is happy, they're going to want to do more and want to help. So give them the ability to do that. Okay, moving on. So, how do we get high performing teams to buy in? What are the common things that we need to see? So, clear communication. Again, communication is key for anything. Trust and psychological safety, accountability, holding them accountable, and a shared vision. Everybody wants to know where the hospital is going, what's expected, what's for the future. These traits are not accidental. Leadership nurtures them, and leadership helps provide these. Management supports them, and it takes intentional effort to build this kind of culture, but it pays off in your staff retention, your team morale, and your client satisfaction. So, how do we as practice managers integrate both leadership and management? The first thing that you have to do as a whole, and maybe you're already doing that, which is fantastic, is define your visions and your missions. What does that look like? Create systems and expectations that support your vision. Delegate when appropriate. Develop leads for your departments. Empower others on your team to both lead and manage. Have direction and implementation. So I know that it was really hard for me in the beginning of my career to delegate, and now I preach on that for people to delegate. Again, your employees are there to help and they want to do more. So what can you delegate? What tasks that you have that other employees may want to pick up or are interested in learning? Is it inventory? Is it SOPs? Is it communication? Develop leads for your departments. Have CSR leads or champions, assistants, technicians, obviously a managing DVM if you can have one. Develop leads and delegate when appropriate to help you in your position and make your team be at their best. You want to empower others on your team to do these things as well. If you can lead by example, they're going to want to do the same. So if you're a good practice manager that can show both leadership and management and how they coexist together, your other team members will pick up on this and learn from this as well. So, what are some tools that we can use to utilize these things? Weekly team huddles to set goals and clarify expectations. Fantastic. One of the things that I did with my team was to meet first thing in the morning. Everybody did, all departments, just to say, like, hey, I'm here today, or so and so is going to be coming in the afternoon. This is what we've got going on today, just so everybody has that communication of what's going on in your hospital and what's to expect for that day. Maybe it works better for your hospital to have morning, midday, and afternoon huddles. It helps tremendously with the communications, the task at hand, and communicating as to what's going to be happening in the practice. If you're not very good at setting goals and clarifying expectations, AI is fantastic for this. You can generate goals and expectations. Now, AI is not the end all be all. Please hear me out. It's just for you to use as a guide and then to customize it with your own goals and expectations. Feedback. One of the things that's most important with your team is that you have feedback and one-on-ones with your employees that aren't about how they're doing their job, but also about how they're feeling. Is there anything that they can help with? What things are they liking? What things are they not liking? And distinguishing between the two of having performance one-on-ones and just checking in one-on-ones. It will make a world of difference if you can, in your day somehow, schedule one-on-ones that are just to check in on employees, and then one-on-ones that are performance based. How are you doing on your performance? What can we excel with? What does that look like? Delegation charts to clarify responsibilities. Maybe that's something that you guys post in the break room. Maybe you post it in your departments that just holds people accountable. Post charts or graphs to help the team have that tangible expectation and know what needs to be done. Recognition programs, invest in your future leaders. One of the things that happened at our practice that my DVM loved, and I'm sure you guys have something in place too, and I can't wait to hear about this when we do questions and answers. But we had an employee of the month board, and it would post the employee so the clients can see it. We would get their favorite snacks. We would provide lunch. We would do a gift card. Like, we literally would just all together select one employee of the month who has done really good, whether that was meeting expectations, going above and beyond, stepping up, just to recognize them. It means the world to be recognized and for your leaders to recognize you. So having something in place, maybe it's just a $5 Starbucks card every once in a while when you see somebody doing a good job. Maybe it's an employee of the month. Maybe it's a team outing, whatever that looks like. Recognize your team, blast them on social media, tell your clients about them and how well they're doing. Team building activities. Love, love, love doing team building activities. The one caveat I would say to this is don't make it a requirement for your team. They don't want to all be there. They don't want it to be required. If you have a good team that's cohesive and like to hang out, fantastic. But if you can schedule team events outside of work and not make it a requirement, You will have so much fun. Go bowling, do an escape room, go eat dinner, go do something outside of work where everybody can be themselves and not be them work selves and just have fun together, right? That's how you get to know your team, things they like, things they don't like, and just how they interact outside the work world. A couple of more tools. So I just highlighted there are tons and tons of books and podcasts out there that you guys can utilize. A couple of my favorite books are Leading and Managing Veterinary Teams by Amanda Donnelly. I met her in person and actually had her sign a book. If you guys ever go to any big conferences, she's usually there talking and she's fantastic. The book, Oops, I Became a Manager by Amy Newfield, another favorite. Practice Made Perfect is a good one by Marsha Hinkey. There are tons and tons and tons of books out there to utilize and to read and to get goals from. I love podcasts. So VHMA actually does Practice Managers in Your Shoes monthly that just has real life managers and what that looks like, a goal that maybe they're tackling or a task. Lead to Win by Michael Hyatt. There's tons of resources out there that can help you as a practice manager with management and leadership together and how that can be combined and what that looks like for your team. A couple more things that I've utilized. If you have good relationship with your reps, or maybe you're a corporate or private practice that can support this, if you can do some type of personality assessment, whether it's Myers-Briggs or DISC assessment with your team to figure out how each one operates with one another, your personality types, what personality types work well together, which don't. It's usually very eye-opening when you do this. I actually had one of my vendors do it for us for a lunch, and it was fantastic. We found out a lot about our team. Social media, blast your team on social media. Have a digital champion, if you will, that does everyday blips of your team. You know, your clients want to see not just, oh, we came into our hospital today and had a great experience. They want to see what's happening behind the scenes. They want to see the funny, the raw moments. And they want to see the cute patients that you guys see. And they want to see what actually happens to the hospital that they're taking their patient to. So have a digital champion that wants to do TikTok or Facebook or Instagram. Artificial intelligence, so AI. There's all kinds of AI stuff out there. AI is not the end all be all, so please hear me on that, but it is very informational and very helpful. ChatGPT, Lovable, Celeradus, platforms that integrate within your PIMS. So there's a couple, Talkatoo, Dragon Veterinary, Scribe, and there's so many more to explore for AI for things that may help you with your numbers, with revenue, can help you with your SOPs, can help your DVMs with efficiency, whether, you know, that's Scribe, whatever that may be. But there's plenty of AI tools out there as well that can help. Final tips and takeaways from today's webinar is just practice makes perfect. So strengthen your familiarity with the expectation and what is expected of your team. Have those weekly team huddles. Your feedback loops, coach and manage performance. Your delegation charts, clarify roles, give the tangible items to your team. The recognition platforms, celebrate the wins, shout it out to your clients, put it on social media, do something within your hospital. Development plans, invest in your future leaders. We need this industry to continue to grow, and it comes from within, and for us to be able to promote and help our employees that are in current practice right now. So help them be future leaders. Have action plan templates to fill out with the hospital leadership. Reflect on performances, explore new techniques, set personal goals, set them for yourself, set them for your team. Iterate and adapt. Recommend certain books for employees or podcasts. Help you to continue to grow as a great leader and help your team to grow as well by giving them these resources that can help them along the way. Just remember, last takeaway is great practice managers lead and manage every single day. And we're super happy to have you guys in practice And I would love to hear some challenges that you guys are currently facing, or any information that you could take back from this that you might implement. Tell me challenges. Tell me things that you may be facing in today's world. And you can come off mute or put them in the chat. I'll scroll through the chat. Oh, we did a glass blowing class. That sounds fun. Scribblevet has been a game changer on efficiency and time management for us. 100% agree. AI is really great when it works. Yes, Amy, I'm more than happy to send a list of books. Thank you, Daniel, for that shout out. Anyone else with challenges that you may be facing, or anything you want to share that's really worked for your practice?
If everyone's shy, I mean, like I said, I spent a good portion of the last few months interviewing different practice managers, and not to tell their secrets, but there's a common through line with a lot of these chats that I had. And it's that, uh, and a lot of it is around team building and around training and communication, and being able to have the time to actually focus in on a holistic approach to training. Um, and so that's one of the general struggles that I saw, and also implementing new technology and implementing new um, SOPs, things like that. It's uh, whether there's lack of support on the side of whatever technology vendor you're using, or if you're using like a new PIMS, um, you know, sometimes the lack of communication there can be a struggle that from what I've seen. And just the whole implementation process and people remembering to implement new tech. Oh, Sandy says, I really like the Positive Leadership podcast as well, and anything from Brene Brown. She's great.
She is.
Um,
Yeah, and I think it's important too, and I feel like all of you already know this, is to just carve out the time for your team. I know that we are all very busy and we are trying to put 15,000 fires out of day. But if you can carve the time to just dedicate to your team for this purpose and to show up and be there for them, you will see a huge, huge change. But for us, we just actually have to make the time, because I know, being in practice and dealing with all the 15,000 things that we have to deal with, you just have to make time. You really have to support your team and make time for them, instead of being stuck, behind the computer trying to do all the other 15,000 things that we need to do. So it's just super important to have that style for your team and to carve out that time for them as well.
yeah, I agree. And what else? I'm trying to find the kind of takeaways that I had from all of these interviews as well, just to kind of like get the conversation going. I mean, yeah, I think outside of uh, working, internally, I think I've seen a lot of like client acquisition strains, and so I think in part some of your tools and ideas can help with that, just because the process has been like very manual for a lot of people, and then when they switch to different tech opportunities, it's sometimes impersonal. And so there's this constant balancing act that people need to kind of walk to have an efficient strategy for getting new clients and for retaining the clients that they already have.
Yep, I would completely agree with that. It is hard to balance, because you do want to make things a lot easier with technology, but then also you still have the clients that really appreciate that personal phone call or that personal email. That's just like the interaction, that it is personable and it's not all automatic. So it is very important, just like you said, Daniel, to walk that line to figure out what best fits your culture.
Right. Exactly. Yeah, the culture is a big part, and not delegating any sort of human work to technology, right? Like
Yeah,
if
for sure.
it gives your clinic a human touch and is important in that way, then, you know, looking to offshoot that with technology sometimes is not the answer. But yeah, this is great. Everyone's saying great job, Sam. This is great, so informative. See you in NOLA. You continue to be awesome. This is a fabulous, informative webinar. Look at them. They loved it. That was amazing, Sam.
Thank you guys for the support, and thank you guys for carving out an hour of time today. I really appreciate it. It really means a lot.
Yeah, if you don't mind, I'd be happy to post your LinkedIn in the chat if you want.
Sure.
So
Yep.
folks here, they can add you on there. And I don't know if you want to, you know, make the offer to send out the presentation to anyone in the audience, but
Yeah, sure. Happy to.
not. But here's Sam's LinkedIn. Everyone, if you want to connect with her later. And let me put mine in as well. I would love to connect with all of you. I really appreciate you guys coming out to this. And we, like I said, we do these every month, different topics every time, but it always follows a through line of discussing the intersection of veterinary medicine and technology. Thanks, Sam. Would love to know the books on your shelf. That's a good question. Do you have a bookshelf by you that you can go?
It's not in my room, but yes, there is. I actually have a big bucket. I don't have a bookshelf. We just moved into a new house, so they're all currently in a bucket, but there are tons of them. And I very much do a lot of audiobooks too, especially commuting, taking children places, going to do things. It's you know, another thing for technology, like having audiobooks are fantastic. So
Audiobooks. I do this thing where I have to like listen to the audiobook and read it at the same time, and that's like supercharging however I get the info.
yep.
Both of
Yeah, life seems to be a little busy sometimes, and maybe you get interrupted too much to have your paper book by the ocean to read.
I'd love to share this recording with the rest of my ethos cohorts. Thank you.
Yeah, sure. Happy to.
We're gonna have the link to that very soon. I think we should be having the post webinar flyer and recording out by tomorrow. But again, thank you everyone. We're coming to the top of the hour. I want to say thank you again, Sam.
Yeah, thank you guys for having me. I appreciate it.
Yeah, this is great. Everyone, nice to meet some of the new faces here. And I hope we see each other again next month. Have a good one.
Thank you all. Have a great week.